Malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. There are five parasitic species that cause malaria in humans, and two of these species, Plasmodium falciparum and Falciparum vivax, pose the greatest threat. In 2023, nearly half of the world's population was at risk of malaria, while sub-Saharan Africa carries a disproportionately high share of global malaria burden. WHO regions of Southeast Asia and Eastern Mediterranean, Western Pacific, and the Americas also report significant numbers of cases. There were an estimated 263 million cases of malaria in 2023, and an estimated number of malaria deaths stood at 5,97,000. In 2023, the African region was home to 94% and 95% of malaria cases and deaths, respectively. Children under 5 years of age are most at risk of severe complications from malaria. In 2023, they accounted for nearly 76% of all malaria deaths in the WHO African region. Symptoms. Malaria is an acute febrile illness. It in a non-immune individual, symptoms usually appear 10 to 15 days after the infective mosquito bite. The first symptoms, like fever, headache, chills, may be mild and difficult to recognize as malaria. If not treated within 24 hours, Plasmodium falciparum malaria can progress to severe illness and lead to death. Children with severe malaria frequently develop one or more of the following symptoms, like severe anemia, respiratory distress in relation to metabolic acidosis, or cerebral malaria. In adults, multi-organ failure is also frequent. In malaria endemic areas, people may develop partial immunity and allowing asymptomatic infections to occur. Some people are at a considerably higher risk of contracting malaria and developing severe diseases than others. These include infants, children under 5 years of age, pregnant women, and patients with HIV and AIDS, as well as non-immune migrants, mobile populations, and travelers. National malaria control programs need to take special measures to protect people at higher risk of malaria infection, taking into consideration their specific circumstances. Malaria is a preventable and treatable disease. Early diagnosis and treatment of malaria reduces disease and prevents deaths, and also contributes to reducing transmission. The best available treatment, particularly for Plasmodium falciparum malaria, is artemisinin-based combination therapy. Antimalarial medicines can also be used to prevent malaria. For travelers, malaria can be prevented through chemoprophylaxis, which suppresses the blood stage of malaria infection, thereby preventing malarial disease. Prior to their travel to malaria endemic countries or regions, individuals should consult their national disease control centers or other institutions offering travel advice.